Hello, everyone. I'm Dr. Alyson, and this is Dr. Abby, and we're coming to you from The Fringe, our podcast where we talk about all of the things to make ourselves feel better and live better lives and thrive. And today we are going to talk about what a bummer it is that it's so dark in the winter in the majority of this country.
Yes.
And I'm coming from Colorado, where we have tons of sun in the day, but it still is dark right now at 5
Early.
p.m., and it really affects you. So today we're talking about seasonal depression disorder. I want to start this podcast by saying I really don't think you have to be diagnosed with it. The amount of people that get diagnosed with it, I really feel for them because it's probably a very severe case of depression for them in these winter and darker months. But I would say for everyone who lives somewhere in this country where it is
Yes.
dark at 5 p.m., and especially if you're in the northern latitudes, the Midwest areas where it's dark and gray and you're not able to get sun in the day, and then you finish your work day or whatever it may be, and it's dark, this
It's rough.
podcast is for you.
Yeah. Yep.
So, so we're talking about seasonal depression disorder. Disclaimer, you don't have to be diagnosed with it. You basically just have to feel a little down in the winter, not motivated. Winter blues.
Mm-hmm. Yeah.
That's it. Yeah. So what is it by definition, Abby? And then how do you sort of, Abby is still in clinic, so I'm sure you see an influx this time of year of people just saying like, I'm in more pain. Everything relates to our mental health. They are not separate. Our mental and physical health, everything's worse. Yeah. So, so how do you explain it to patients and what are you seeing this time of year?
I see it a lot because I live in Wisconsin, and so basically Canada, right? So, I mean, when I drive my daughter to school in the morning, right now we barely just started. The sun is rising when I'm driving her to school, but a month ago it was dark, right?
Yeah.
And it's dark again at like 4:30. It's pretty wild. And I remember that growing up. I grew up in the Midwest as well, and I was a swimmer, and it would be dark when I went to school and dark when I left the school. And you never see the sun. Gym was inside. Like, honestly, yikes. So, I mean, our bodies are, how I explain it to patients is our bodies are designed fundamentally to be outside so much more than we actually are. And it really comes down to circadian rhythm health. So overall, even in the summer, people have problems with this, but especially in the winter, we really should be outside seeing the sun during the day. And that helps set our circadian rhythm for nighttime. So it's not really, a lot of people don't think about this. Like getting morning sunlight is actually so impactful for your sleep. And if your sleep is off, everything else is off. But, we should be getting like UV rays and real sunshine in our eyeballs, even when it's 5 degrees outside and cloudy, right? We still get that like light signaling to our body, even if it's overcast, even if it's snowing. Being out for even just a few minutes a day is super beneficial. I definitely find my patients with either young children where they like are outside with them more, or even animals, dogs tend to do better because just it's part of your lifestyle. You've got to take your dog on a walk, or kids tend to do a lot better. They've got recess, my daughter's school, unless it's under 10, they go outside for 2 recesses a day, right? So the children, I think, are faring better getting that natural light. But the data is really just kind of like you were saying, if you feel like you have the winter blues, if come fall, especially for a lot of people, daylight savings is usually where a lot of people go downhill.
Yep.
And you just notice like it's a lot of the same keynotes for depression. Low energy, lack of motivation. You don't find joy in the same things you usually would find joy in. Like all of a sudden you stop doing XYZ in the wintertime. Low energy, low metabolism. And there's science to that. Our metabolism does slow down a bit in the winter, and that's kind of the way we're designed to be. But a lot of people feel like they don't even necessarily change a lot of their habits, but they gain 10 pounds every winter.
Yep.
right? So, and then like you were saying as well, I think inflammation just tends to go for people as well. People with joint issues, inflammation, arthritis. You hear this all the time. People are like, I feel it in my bones, right?
Yep.
My pain is worse in the winter. My eczema is worse in the winter. A lot of people just they're kind of, I don't want to say normal because it's not normal, but quote normal problems tend to be amplified in the winter months. So if that's you and you just don't feel as well in the winter as you do in the summer, which is true for many people, the good news is there's so much you can do about it. And a lot of traditional Western medicine doesn't have great answers other than
Yeah.
prescription drugs, having
Yep.
to be on medications. And so between lifestyle, light therapies, supplementation, you can make a massive impact.
Yeah, it's a lift, it's an effort when what you just described is, a situation within people's bodies where effort
Hmm.
becomes even harder. But there is quite a bit that you can do to feel better in
Hmm.
these dark and dreary months. So I definitely think we should tackle them. Something, um, you know, t- to help people understand when you talk about circadian rhythms, it's really, I think that's maybe a term that people don't understand. It's
Hmm.
basically summarizing that our physiology and our biology is really set to the sun.
Hmm.
And so inside of us are our hormones, our neurotransmitters, all the feel good, feel bad chemicals inside of us really regulate to the sun. So this sort of
Hmm.
like the sun is down, the sun rises, the sun goes down again. When you look at so many of the chemicals that we study in our body, they do the exact same thing. And it's in response to essentially the
Hmm.
sun. So if you don't have that signaling, when you wake up in the morning, and it's dark, you right off the bat are like, whoa, your body's like, what's happening
Hmm.
here? Because we are designed to sort of wake and rise with the sun. And then, as our bodies are waking and our energy starts to increase, we're supposed to be receiving all this bright blue light from the sunlight that energizes us. It brings our cortisol levels up, which are good. We need
Hmm.
cortisol, not just too much of it or excess of it, but we need it to be energized and to be productive throughout the day. And then our bodies really, one of the more powerful signaling for our bodies is the disappearance of light or
Hmm.
the arrival of darkness, because darkness signals melatonin, which is that hormone in our body to sort of relax us and get us in a sleepy state. So when you think of the fact that for some people, like you said, wake up dark, drive in dark,
Yep.
inside
Go
all
home
day,
dark.
basically, yeah, go home
Never see
dark,
real light.
never see real light, your physiology, all those feel good, feel bad hormones are all like, what is going on?
Hmm.
What's happening inside of me? So, um, let's start with a conversation about light. And it's comical to say because the best advice to everybody is that they wake up, that they go outside, that they get
Hmm.
20 to 30 minutes of natural light every single morning in through their eyes, no sunglasses.
Yep.
It'd be great if you pair it with a walk or whatever it may be. But at the end of the day, you are not through your windows,
Yep.
actually
Yep.
outside. I know that you're not doing that this time of year in Wisconsin.
Nope.
It's sunny here and don't do that any morning. I have things to do.
Yeah.
Um,
And I think, this is important to talk about because at least in my bubble, in like the holistic, crunchy world,
yeah,
right? Everyone's like, here's my perfect life on my homestead with my homemade cheese, and I'm stepping outside barefoot with my goats with the sunrise every day. Like,
right.
no.
No,
For the majority of people, it's just not realistic. And if that is you, that's amazing.
yeah,
But you know what? When the real feel is -4, I'm not going outside with the sunrise.
yes, yeah.
It's not happening.
Yeah. And I think the compromise there is, okay, there's going to be people where it is actually just too cold. They're not going to be
Hmm.
outside. Maybe they have little kids or whatever. I don't do it first thing.
Yeah.
I have so many things to go do, but I
Right.
do try to walk my dogs
Hmm.
sometime before noon
Yes.
and get that 20, 30
Yes.
minutes. We're probably outside 30 to 45 minutes of bright
Yep.
natural sunlight. So that's my compromise. But
Yes.
if you're in a scenario where for a few months that's really hard to do, there are things that you can do
Hmm.
to supplement light. People, they actually have names for them. They call them SAD lights,
Hmm.
seasonal affective disorder lights. But at the end of the day, basically people try to simulate that bright, bright, bright
Yep.
sunlight in their homes in the day. So if you read all the research on seasonal affective disorder, this sort of state of sort of depressed way of feeling, you can go get a sad lamp. You can go get
Hmm.
it's a bright white lamp. It's super bright. You sit in front of it and you
It's really
basically just
intense.
it's really intense.
Yeah.
And you basically blast yourself with bright light. So that is
Hmm.
a way to tackle these hard months. We don't make at Fringe those bright white lights. You can buy them on Amazon or wherever. And I think for some people they really help. We tried to talk more about sort of these natural wavelengths of light we receive from the sun, like in the morning with sunrise, this red and near infrared, and then in the evening with, sunset, this red and near infrared. So how are you talking to your patients, maybe just about like lighting in their home and what you want them to be doing to try and make a couple changes to their
Yep.
lighting environment?
Yep. Um, it's like you said, I think, man, you get such a big bang for your buck, and it's really, it can be a very affordable change to make for people.
Yeah,
And it's, not sexy. It's not some like fun new, crazy vibration plate you need to buy. It's like changing your lighting environment so you can go all the way, like the cheapest, easiest way to start is at the beginning of the day when that period where it's still dark, maybe like a little bit of sunrise. At both bookends of the day, you want to keep your lighting as low as possible.
correct.
That can be just dimming your lights. That can be using candles instead of these bright overhead like LEDs that everyone has in their home now,
Yeah,
right? No one has like those um soft like glowy lights anymore. But I do think there's a big movement back to that. But you can do like salt lamps instead. You can even
yep,
buy like LED little fake candles that are more orangey. Like that's
yep,
going to help all the way to there's some companies out there that make really, really healthy lighting for your home that are in like good healing wavelengths of light that are no
yep,
flicker, that are low EMF, that, that's kind of the top tier. But even if you don't have those lights right now, you can just start having really low lighting. Like I have a lot of lamps in my house. I don't like
yep,
the overhead bright strips LEDs and we like dim everything. And
yep,
then my ultimate favorite is, of course I have one. A lot of my patients have a red light therapy panel.
yep.
Okay. So I tell my patients, you
This
want to have
baby.
that sucker in like your main living area on
Yep,
the ground
yep,
and have it on like the first hour you're awake and an hour or two before bed. Makes a really, really big difference for people because that's how we're designed to see, sunrise, sunset, right? Like higher red, it
yep,
doesn't disrupt your circadian health. So, and they're really quite bright. I don't know if you guys could like kind of tell from that visual, but
yep,
that panel lights up our entire family room area, no problem. You really don't need much else. So, and we did like I have red bulbs in our bedrooms in our nightstands.
yep,
So, but there's companies make ones that can switch from like blue to red to amber based on the time of day. So, the really nice thing is there's like we've been talking about, this should be like an empowering conversation, not a
yeah. There's
doomsday.
lots of
We're all
options. Lots of
dying from
options.
LEDs. Like
Yeah,
now we just have an awareness of why we feel so
yeah,
crappy in the winter. And there's
yeah.
so many easy things we can change to shift that.
Right. So basically, in the day, absolutely everyone's working. We do work in some harsh lighting environments. If you can change your lighting in the day to be more natural lighting, it's really great for you. But basically, in the evening, dimming your space. Because, like what I
Hmm.
said when we started this podcast, the absence of light or that sun going down is what signals
Hmm.
the release of melatonin in our body, which is our rest hormone. And a lot of people supplement melatonin. So
Yep.
let's unpack that because I would think a
Yep.
lot of people get into these winter months, their sleep gets super disrupted because they're in
Yep.
dark all day, and
Yep.
then they're popping melatonin gummies left, right, and center, whereas
Yep.
light can actually be, and is what's designed to be, what
Yep.
stimulates that melatonin release.
Yep. Yeah, I mean, true light deficiency is really the root cause of people needing melatonin, right?
Yep.
So I just did a post about this, about how like melatonin isn't fixing your sleep. If you need it, it's actually showing you what's wrong.
Yep.
If you have sleep problems and melatonin doesn't help you, then your circadian clock is probably pretty well established.
Yep.
But sun goes down, cortisol lowers. That is what allows melatonin to rise.
Yep.
So if your house is lit up bright blue like it's 2 p.m., you don't stand a chance.
Nope. Cortisol
There's
stays
no way,
high.
right?
Yep.
And
Yep.
then that is commonly shows up, at least for my patients, as they often explain feeling wired and tired at night.
Yep.
So they're physically exhausted, but their brain is going, going, going. They could like plow through emails at 9:30. Like that's so
Yep.
not normal, especially when it gets dark at 4:30.
Yep.
So your
Yep.
body thinks it's, after
Yep.
lunch and it's time to get ready for bed. And it's really hard to fight that. And so then, of course, that person, I would much rather have them taking melatonin than like a sleep aid, right? Or like
Yep.
NyQuil.
Yep.
But what that really just means is what we've just said. You need to get outside
Yep.
earlier in the day, throughout the day, in a 5-minute break on your lunch, get your eyeballs on the sun,
Yep.
right? And dim lights as the sun goes down. Just make your indoor environment in alignment with the outdoor environment. And man, very quickly people see a difference. And
Yeah.
then they usually can wean off melatonin completely. But it
Which
is,
is it's important, like that
it
conversation
is.
about melatonin is a hormone that our body
Yes,
makes. And so when you
correct.
supplement it,
It's a
your body
hormone.
is like, what are you doing? I'm making
Yeah.
this.
Correct. It's what's called a negative feedback loop. So if you are stuck taking melatonin, I really feel for you because it is kind of like a catch-22 that it can work really well. And your body has then shut off making it on its own because it's present in your system from your supplement.
Yep.
Right. So my goal with patients is always to get them off melatonin eventually. It doesn't
Yep.
have to be like a cold turkey situation where then you don't sleep. But there's good data on melatonin supplementation for other things, but for sleep support, it's more just showing you where the cracks are.
Yes, for sure. Okay, so to summarize, for me, my whole house just glows. I don't
Red.
know what the neighbors think, and I don't care, everybody.
Yes.
This house glows a nice ambery
Yep.
red in the evenings. You walk in here and you may need to adjust a little bit because there isn't bright lights
Yep.
anywhere. I do change my light bulbs. I have incandescents. They have a low,
Hmm.
like amber glow to them. I have those, over my kitchen island, which is the busiest
And
place.
tell people too, when you switched to that,
Yeah.
you immediately feel different.
You
It's
immediately feel
nuts.
different. It's so for your kids, for you and your family
Yeah.
members in your home, just saying, okay, I'm going to try and make, if you have some sort of panel, use it to illuminate the room that everybody's kind of hanging out in after dinner.
Yeah.
It's after the sun goes down, low and dim lighting in your house. The panels are a red wavelength of light that we do receive through our retina in our eyes and have a lot of effect on our physiology.
Hmm.
But it's so important for me to then honestly say too that darkness, the lack of sunlight, is so important for our
Oh, for sure.
bodies too.
Yeah.
So don't take it like, oh, I have to have a red light panel to illuminate my home. Nope. That's not the message here. The message is that bright light in the day needs to be natural. In the evenings, our environments need to be dim
Hmm.
and low, orangey, reddy environments if they can be. If not, like you said, just dimming your lights, keeping the darkness there so the
Hmm.
body isn't confused, in the evening, so to speak. So that's a summary on light. I would say the panel for us, A lot of people use it on their body, which can have a lot of benefits for depression as well too. It's just really
I
good
was gonna
for
say, even like
over.
blasting your face for 5
Yeah.
to 10 minutes is really good for
Yes,
that.
because it's a bright light. It's really bright. You
Yeah.
can sit with this, like I have this in my office and I can sit 10 to 12 inches from it and just take light in, all through basically like a third of my body.
And you
Probably
do
like
eyes
up.
closed.
I do eyes closed just because
Mm-hmm.
it's so bright. I do eyes
Correct.
closed and I just do that as a session, which also is helpful for depression. So just like kind of switching from the how's my home, how's my environment,
Yeah.
how that does that affect, like also there's a lot of things you can do for your body to make you feel good. Before we talk about um sort of the internal environment and talk a little bit about the lack of sunlight and that effect on vitamin D levels, coupled with the fact that everyone's getting colds and flus in these months and that sort of thing. Let's talk about magnesium, because I know that you recommend that for a lot of your patients who are dependent on melatonin, wanting to improve their sleep, depressed, all this sort of stuff. So let's
Mm-hmm.
talk about magnesium. Split for a little bit.
Yeah. Magnesium, man, it's probably up there in my top 3 supplements that everyone should take every day for a million reasons, this
Yeah.
being one of them.
Yeah.
It's such a low lift, big bang for your buck, relatively inexpensive. If you struggle with stress, sleep, you want to address heart health, inflammation levels, muscle tension, like magnesium, headaches. I could go on and on. But magnesium is really effective at helping to calm.
Yeah.
And so, I mean, there's a reason so many people, it's like been a trend for a couple years now on TikTok, like magnesium cocktail before bed,
Right.
right? There's a reason because it's super effective for a lot of people. And magnesium also helps lower cortisol, which we were talking about earlier.
Yep.
So many people, I do a lot of hormonal and cortisol testing in my practice, and so many people are high cortisol at night. When you
Yep.
do a cortisol map test, which kind of maps your cortisol throughout the
Yep.
daytime hours, right? A lot of people get a spike at night. In my opinion, that's hugely due to light environment, right? So nighttime, body doesn't know what time it is. You're looking at, blue light right here in your face.
Yep.
Hi,
Yep.
right? Anyone here that feels like they get a second wind, like, oh, at 9 p.m., I'm like ready to go again. At 7:45, I'm exhausted, but then I get a second wind. That's a cortisol spike. Okay. Magnesium is super powerful at lowering that cortisol. So, thus, in a roundabout way, magnesium can also help melatonin, which we were saying.
Yep.
But I also really love one of the forms of magnesium in our product is magnesium glycinate.
Yep.
And glycinate specifically, glycine, is very effective at calming the mind. So, especially if you're the type of person where you're tired, but your brain won't shut off at night, you lay down and you're like making lists in your head and thinking about the day or the next day and just can't shut your brain off, magnesium could really help that come down. So, I love to have my patients take it, you know, after dinner, an hour or two before bed, somewhere in that window, just part of their kind of nighttime routine. Um, and it really is helpful.
Would you say for patients that sort of are in the winter blues, seasonal affective disorder, are they taking more magnesium than normal or just normal amounts?
That's a good question. I would say more the people that struggle with a specific symptom would take
Okay.
more. So, a good example would be people with more pain and inflammation during
Yeah.
the winter. Um, People that, get a real bad second wind and like can't sleep, people that are more stressed out, more anxious in the winter.
Yeah.
But I would always tell people first start out with like 1 dose a day at night and see if that does it for you. But if you feel like you take magnesium and it does great and you don't feel like it works as well in the winter, then you certainly could double up on the magnesium you're taking, especially if it's one like ours that doesn't
Yes.
disrupt the gut and,
Yeah.
have any like negative digestive effects.
I'm doing 2 scoops right now, and
Great.
that's new for me, doing a scoop in the morning. Always do a scoop at night, but doing a scoop in the morning, just to see if it helps with some of the inflammation,
Yeah.
that sort of stuff, that happens more for sure more so this time of year for me.
Yeah. Yep.
Plus just hormone stuff as well. Okay, so vitamin D. So if you pull up seasonal affective disorder and you read about it and you read, yes, there's a lot of pharmaceuticals that are prescribed, a lot of antidepressants. Basically,
Yep.
that's first line of defense. If you go in, doc, I'm really feeling down, like here's all my symptoms, you'll more than likely be prescribed
Yep.
antidepressants. We've talked about light, we've talked about magnesium as two really incredible approaches to help with some of the symptoms. But the interesting thing is starting to look at vitamin D, which we talk about a lot. We talk about
Hmm.
how we're so deficient in light and what those effects are on our circadian rhythm, but the effect on our vitamin D status and the impact of that on more than just being able to fight the average cold and flu
Hmm.
is staggering. So talk about vitamin D, mental health, physical health, like the whole picture.
Yep. I mean, most people realize this because they notice they just feel a better mood in the summer. Or even like
Yes.
today, you can see behind me, I look like I'm in heaven because the sun's
Yeah.
out.
Yeah.
I was outside with my dogs. It's like 30 degrees. I'm like, it's amazing. I want to stay outside. Right. So
Yeah.
you just, I mean, some people are now classifying vitamin D as more like a hormone.
Yeah.
It's like one of the happy hormones. Right. And we make it naturally from the sun. So, like how we were just talking about, then in the winter, we especially don't see the sun. You like don't stand a chance at making vitamin D, which kind of like magnesium is so foundational for so many effects in the body. But I mean, I could go on all day about patients that actually I think don't really have seasonal depression. They just have extreme vitamin D deficiency.
Extreme vitamin D
Extreme.
deficiency.
I've seen people in the single digits. For reference, I want people between usually 40 to 80. 60 is like a great target in my practice. And I've seen people at like 8.
Yep.
The majority of people I test, even in the summer, are under 20. I mean, it's
Yes.
shocking, shocking. And they will, most Western medical doctors won't even test their vitamin D because they tell them it doesn't matter. Even if they will, this is a perfect example between kind of more functional holistic medicine and Western. Western, the scale, you know how you get your blood taken and it's like, here's the range you should be in. The normal range for vitamin D is between 30 and 80. That's such a massive
Yeah.
range.
Yeah.
And so patients test and they're like 27, they're told, you're fine.
Yeah.
You're close enough. And I'm like, oh my gosh, at 27, you probably have pain. You're probably inflamed. You probably feel depressed or anxious. And they're like, yep, 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 yep. You probably get sick all the time. Like, it's such an easy fix. It makes me so mad that
So
basics like
mad.
this are missed all the time. Like, and they're told to go on medication. And it's like, let's just get your vitamin D up and see how you feel. So I just had a patient, like, kind of the perfect storm, postpartum, kind of baby blues plus winter blues,
Oh,
really not feeling well, considering medication. Her doctor, of course, said blood work isn't important. She doesn't need it. So we drew labs. Her vitamin D was like 13.
yeah.
Put her on a crazy dose. In like a week, she was gone. So it's just so impactful. So I always tell people start there, because a lot of people, for whatever reason, light environment, not being outside enough, genetics,
Yep.
they just don't absorb vitamin D well. And especially in the winter, it's such a no brainer to get your levels checked. And a lot of people need to take 2 or 3 times their normal dosage in the winter to maintain a healthy level. So there's a genetic thing, like I have it. It's called a SNP. It's like a, blip in your genes, if you want to look at it that way. That makes it so it's really hard for you to absorb vitamin D and to get your levels higher. A ton of people have it. It's very common. A lot of people don't know they have it. I'm this case, so I need to supplement vitamin D year round. Even in the
Yeah.
summer, I would be under
Yeah.
30. It doesn't
I
matter
do.
if I was at a soccer tournament all day long. It doesn't matter. I just run low.
Yeah.
And so I always encourage people, we say this at Fringe, like once a year at least get your vitamin D levels checked. It's very inexpensive. You can now just go get that yourself at most lab companies. It's a benign test. Um, and see where you're at, because then you can really customize your dosage for your physiology. Because on the flip side, I've had some patients that absorb it super well and they get vitamin D toxic.
Right.
So that can happen.
Yes, because you
So
can take too much vitamin D. So here's an important fact, because we get asked this all the time. We make vitamin D in our bodies through the absorption of UVB light.
yes.
None
Yes.
of the red light therapy products you buy in anyone's markets have UVB light. There's
Yep.
very few products that have UVB light in them, but your tanning salon does. And
Yep.
you know what that was like in the 80s and 90s. If you were with me, we were in there, we
Yes.
were feeling good.
The
So,
stickers.
oh yeah, remember the little hearts?
stickers. Or a
Oh my
cherry.
gosh.
The lotions with God knows what in them.
Oh, they smell like so good. Okay, so we make vitamin D in our body from the absorption of UVB light on our skin. So just think
Not
of
through clothing.
not through clothing. Think
Not
of
through
your
sunscreen.
environment, not through sunscreen, not through your windows.
Yes.
Really important.
Yes.
So if I even think of myself in the summer, I'm not scared of the sun at all. You
Yep.
know, I don't want to
Yep.
burn. So I protect and, try to avoid midday sun and just wear hats or
Yep.
covering or whatever. But in no way, shape, or form am I getting hours a day of
Right,
sunlight through the
direct.
majority
Yeah.
of skin on my body. And I don't think most people are. The
Yeah.
lifeguards,
No.
power
No.
to you. You probably are, and you don't need. So I do think you're right. Some people in the summer, they don't need to supplement vitamin D. They get enough light exposure. Their genes are correct. That, just all in all, it works for them. But for the rest of us, it's pretty hard to get
Yeah.
that much UVB exposure,
Mhm.
which is why we talk. When we started making supplements, I said to you, as the worst supplement taker possibly in America,
Of all time.
I said, okay, for me, I think this is going to be a great pair because you and our scientific director, Jen, are so knowledgeable and so good at this stuff. And you guys would drink mud if it was good for you.
Right.
I'm not drinking mud. I need it to taste good. I need
And
it
you don't
to
like
be easy
pills.
to do. And I hate pills, guys.
Yes.
So Fringe, owned by the worst supplement taker in America, is now
It's a good balancer.
it has to be a good balance. And so I said to you and Jen, I said, what I want is a very honest account as to what we tell people is actually essential to take. There is so much we can take that helps us. I want a company to be honest about what you actually need to take because you cannot get it every day because you cannot get it from the environment we live in. And yes, there are some exceptions to the rule with some people with vitamin D and some exceptions to seasonality. But for the most part, for most people, supplementing vitamin D is essential. That doesn't mean if we couldn't change how we're all living, that would be the case, but we're realists. So then we went down this road of making vitamin D, and I do think talking about vitamin D for seasonal affective disorder is so important. It should be foundational that if you are feeling down in these dark months, that you go test your vitamin D levels, you listen to what Dr. Abby said, and you understand. You ask your doctor, can you please check my vitamin D levels? They're 27. You know what? I'd like that to be 50 or 60 or 70. And then you start, taking vitamin D. So then you go to Walgreens and you stand there and you look at the sea of vitamin D. And what do people need to know, Abby?
They all suck.
Well,
turn around and walk out the door. Because this is the other thing I have seen over and over and over and over again in 10 years is that many of the people with the vitamin D of 27 are actually taking vitamin D every single day. But they're taking a poorly absorbed form and they're taking a dose that is way too low that it will never raise their levels. Too low. So most, if you guys go in Walgreens, even Whole Foods, I'd say the standard over-the-counter vitamin D supplement is around 1,000 to 1,500 IUs.
Right.
And they'll say that's the daily recommended dose, right? One capsule, one squirt of your tincture, you get your 1,000 IUs.
Yep.
Most people need 4,000 IUs a day to even maintain their levels.
Right.
So that's not even to raise them, right?
Yep.
And let alone raise them quickly. So it can take quite a bit of time. In my practice, and I wouldn't recommend doing this unless you're working with a provider, but I will put patients on a very high dose for a few weeks and then retest their labs to move the needle so that in a week or two they're feeling better, right? So
Right.
1,000 to 2,000 IUs is just not going to do that for most people, um, which is why most higher quality vitamin D supplements you will see, the average dose is going to be around 5,000 IUs
Right.
in a
Yep.
capsule, in a scoop, in your daily dose. And it needs to also be, for the people listening, vitamin D3, which is the active form of vitamin D. It's insane to me that this is still happening, but a lot of Western medical doctors actually prescribe prescription strength vitamin D that you have to get from the pharmacy, and it's vitamin D2, which is the inactive form. So people will be taking like 20,000 IUs of vitamin D2, their levels are still low. It's like, yeah, because you don't absorb it well. It's not the active form. It's the form that's in some foods and stuff, but it doesn't move the needle fast enough.
Right. And so there's the form of the D. There's also what it's paired with, which can you talk
Yep.
about? And then we'll talk about the delivery, oil versus
Absorption. Yeah.
what we went and did. Yep.
Yeah. Yes. So most super high quality vitamin D products are also paired with vitamin K,
Yeah.
the specific form of vitamin K, vitamin K2. So a lot of people get that confused and are like, "Oh my gosh, doesn't that give you, bleeding disorders or whatever?" Because they've heard of K1. That is kind of responsible for that and blood clotting and all of that. Vitamin K2, it's actually not really for the absorption of vitamin D, but it's really important that D and K go together. Think of them like superhero sidekicks, right? So, what vitamin D does when it gets into our system is it frees up a bunch of calcium. Okay. If you do not have enough vitamin K2, which, spoiler alert, you don't, it's in really weird foods we don't eat enough of. So, much like vitamin D and much like magnesium, most people are deficient in K2. K2 is really, really cool. It goes and scavengers all this free calcium in our tissues and puts it back where it needs to go, which is the bones and the teeth. So, I mean, there's studies on K2 and like osteoporosis. It's amazing. And so it's amazing for heart health. There's studies on athletes supplementing K2 and their like aerobic capacity increases like as if they were training in altitude just from supplementing K. It's so cool. So D3 and K2 should go together. Just especially for that calcium regulation, because if we
Right.
have a bunch of free calcium floating around in our system, which so many of our foods are fortified with calcium, so it's added to supplements where it doesn't need to, like a lot of people actually, in my opinion, have too much calcium floating around in their system. They don't really have a deficiency. What ends up happening is it can stick to the arteries and then plaque sticks to that, causing atherosclerosis. It can cause stones. A lot of people have kidney stones, bladder stones. It just builds up in places it shouldn't go because you don't have the vitamin K2. So, especially if you're taking a higher dose vitamin D in isolation without K2, you want to pair those together so you don't end up with issues down the road.
Correct. And then for me, I was taking 5,000 IUs of vitamin D
Yep.
regularly as like
Yep.
a general daily dose, but taking it, in an oil format. And
Yep.
obviously we have spent a lot of time. There's actually nothing wrong with it in an oil format. You
Yep.
just need to
It still
know.
works. You
Yeah, you
just
need
need
to know
more.
the nuances of the fact that when we take any supplement, not just vitamin D, any supplement in an oil format, the
Mhm.
absorption into our small intestine is the best way, so it can spread into our blood and do the work
Mhm.
that it needs to do, is really reduced. It's affected
Mhm.
by what we're eating when we take the supplement, and then just the fact that oils are very poorly, absorbed. So to not make this a vitamin D, too long of a conversation, we dove into that. We knew quite a bit about making water-soluble supplements at the time. I was super excited because my vitamin D was in a capsule and I'm the worst pill taker in the world. So we went down the road of making a vitamin D K supplement that's in a powder that also people can take 5,000 IUs and get 5,000 IUs.
Correct.
Which is really important. They don't have to take as much of our supplement to feel the benefit of supplementing vitamin D.
Yes. And I'm going to do a little demo while I'm talking. This is our vitamin D. So cute.
So cute.
And I feel like a huge benefit of it as well is because so many people don't eat breakfast, right? They're running out the door, whatever. Okay, vitamin D, like we're talking about, and vitamin K are fat-soluble vitamins, meaning they're oils. Meaning, in order to absorb them, you have to eat something with fat in it, which a lot of people don't. Or they're having a quick smoothie, or they're not eating till 11. But
Right.
what are they doing? You wake up, you take your supplements, you run out the door. And so then that's also working against you to absorb the vitamin D, right? Because you're taking capsule on an empty stomach, so you need to do with food, or your kids are picky, they don't want breakfast that day. It's kind of a mess, right? So you're just doing your best to get it in them, but it's so poorly absorbed. And that's what I've seen with patients on oils. I mean, they'll have to take 20, 30, 40, 50,000 IUs to really get their levels up. Because also, how many people's guts don't absorb things well? They have gut issues.
Yep.
They have leaky gut. They have low enzyme load. So this just makes it so easy and takes the work off of your body too. It's completely flavorless. I have moms that sprinkle it on their kids' oatmeal in the morning and they eat it, right? But you can put it in water, a smoothie, juice, whatever you want. So easy. And it dissolves perfectly.
The
It's our
vitamin
best
D
dissolving product for sure.
made for Alyson. Yeah, it's perfect.
Everything we've made so far is made for you. But it really benefits a lot of other people, which is nice.
Yeah. If anyone else out there is just a normal person trying to navigate feeling better, living on this earth, I'm with you.
Send Alyson an email.
Send me an email. So if it's easy to do and easy to integrate, that we're going to try to go have it be a part of products that we offer. Okay, so I think that's amazing. Change your lighting.
Yep.
Look at what you're doing to support your sleep. Consider looking at melatonin and what you're doing. Magnesium, foundational and so important. Vitamin D, really, really critical for how you feel during these winter blues. There's one thing that we forgot to talk about, and we'll close out our talk today on it, which is that my favorite product we make. It's very hard because of this headset.
Oh, you're going to do a costume change?
Yes, hold on.
Yes. It really works perfect with the headphones.
It does.
It looks great.
Okay, so this is our head wrap. This is designed to deliver red and near infrared light into your brain. And there is definitely some really great information out there about depression, severe depression, even studying and looking at red and mainly near infrared light absorbed into the brain to help with inflammation in the brain, and then also the brain's ability to kind of rid itself of toxic buildup or waste. And so utilizing this head wrap and actually utilizing it at night before you go to bed. So doing your 20-minute session before you go to bed at night when you sleep, that's when your brain washes itself. It's when a lot of your body washes itself, but especially your brain at night. That's when there's a system in your brain called the lymphatic system. It's basically like the lymphatic system in our body, but for our brains. And it washes your brain and gets rid of any sort of gunk that's built up in there, throughout the day. So this 20 minutes before bed, we've had some incredible testimonies of people with mental health and other, just mental health struggles utilizing this before bed. So seasonal affective disorder, lighting in your house, magnesium, vitamin DK, and then also looking at treating
Mm-hmm.
your brain with some
Yep.
light. Yeah.
The last thing I would add that for a lot of my patients, I think it's almost like a constitutional thing you're born with that just really struggle in the cold winter. Honestly, I like prescribe them, you have to go on a vacation somewhere warm.
Oh, God, yeah.
Like it makes it's a thing.
Yeah,
If they like know in February I'm going to Florida for a long weekend or whatever, it like
absolutely.
honestly makes a big it's really underrated. Get
Yeah,
somewhere or Colorado. I mean, I don't care. Somewhere where there's more sunshine and where you can have some time off. Like that can really boost your vitamin D levels really fast if you're somewhere outside that's warm for a bit.
right. So now we've prescribed you a vacation
Vacation.
as
You're
well,
welcome.
which is really important. Yeah, I will say, like you said today, it's 30 degrees and you got outside. It's not the easiest thing, to
Mm-mm.
force yourself outside when it's super cold. I agree with you. I do it for the dogs. I just thank them
Yeah.
in the process because there I
Yeah.
am,
It's helping
out
you
there,
too.
and I'm like, oh my God. I mean, uh, I'm also not the person who's like, ooh, I am really enjoying this. Walking these dogs in the freezing cold, It's
You're
like,
like cursing with every step. Yeah.
I'm like, wow, this is extremely cold. And I'm head to
Yeah.
toe, geared up. But,
Yeah.
the more we push ourselves to do things like that,
Yeah.
the easier it
Listen,
becomes.
our ancestors were still having to be outside regardless of the weather.
They
Like,
were. We need to
it's
channel
not
them.
fun, but,
Yes.
they were out there and it helped their bodies in a lot of ways.
Yes, absolutely. So, anyway, thank you for listening with us today, talking about the winter blues. They're almost over, guys. Sun's setting here now, like 5:30, which seems celebratory because it was
Yes.
4:30 about 3 weeks ago. And I think the seasons are extremely healthy for us. So,
Me
for our
too.
southern neighbors who don't know the struggle that we're on up here,
We got more grit.
we're just going to come vacation where you guys
Yes.
live all year. Yes, but we're tougher. We're tougher than you. Just kidding. Okay. Thanks for joining us, everybody.
Bye.
Bye-bye.